There are so many things that you need to know, especially if you're going to be using these avatars, these companies for doing evaluations. The final evaluation, no matter what, is going to be in the clinical setting because you just need to see things done there because no matter what, it's not the same.
Can you
But
drill down on that a little bit? I think a lot of these, I think a lot of people would argue, or these companies would argue, if you're doing the AI sim at the institution, that is the clinical setting, right? But is that true? So what do you mean that
it
the
doesn't
final
it
evaluation
doesn't
has
it
to be in the
doesn't
clinical
matter what
setting?
I think. AACN, NLN all say for accreditation that the final evaluations as we're moving to competency-based education need to be done in the clinical setting.
So like
It's
at the hospital in front of a
at
real
the
person.
hospital, at the nursing home, out in the field, in a person's home, in home health, at the hospice center, wherever that is, if those were where the clinical outcomes are supposed to be evaluated for competency as a name your position, yes, then they're supposed to be done in that setting.
Those are
So
all people, what you just described. Those none of those are an autonomous AI, right?
no,
Every single one of those is a human being, a professional with
yes.
experience and wisdom that are evaluating a human being, making clinical decisions and making sure they're doing a
That's right. With
competent
the
job.
limitations of the setting around it, do I have everything I need in this person's home to be able to do the care that I need? Do I have everything out in the field that I need to do the care that I need? And the system cannot make that up. I have to be able to think in that
Hmm.
situation to be able to use the resources available to me to handle the situation.